For our next topic, we will learn how to maximize the use of the open phase techniques for basic first aid and wound management. In definition, a bandage is any clean cloth that you can use and apply to help someone who has an open wound. And when we say any sterile cloth, that is pertaining to a sterile gauze bandage. The rule of thumb is that we have to maximize the mentality of the two lesser evil concept. Meaning, the goal for first aid would be for you to go back to the three basic objectives, which are again, alleviate pain, prevent further injury, prolong the victim's life, and then promote recovery. So for example, if the bandage is dirty, can we still use it or not in applying first aid? Worst case scenarios, we would want to maximize the use of our working hands in applying first aid to a person who got injured. So, using a dirty bandage to a person who has a bleeding injury, severe bleeding injury, would be a lot better than letting him bleed to death over getting an infection because of using a dirty bandage. So, the idea here is do the lesser evil. Losing a lot of blood can lead to what we call the hypovolemic shock. However, getting an infection can still be treated within 24 hours. So which is better? You losing a lot of blood can lead to death and hypovolemic shock, or getting an infection that will be treatable within 24 hours. Of course, it's more on the infection. So for the different types of wounds, we have what we call the open wounds. For the first technique, what we will be doing is to apply first aid to an open wound on the top of the head. So the first thing that we have to do is talk to the victim and then assess his mental capability to answer back to your questions, because we are actually assessing his mental awareness after a certain incident. That way, you can be easily able to identify on whether the person has any concern about mental awareness, because 90% of people who die in any form of vehicular accidents are commonly caused by brain damage. So for this first injury, the head topside technique is going to be applied, because what we have here on top of the head would be an abrasion injury. So the first thing that we have to do will be to clean up the wound. Then afterwards, we can apply what we call a sterile gauze bandage. And because we don't have any medical tape, we can actually maximize the use of our triangular bandage to keep the dressing in place. So, what we have to do is to fold the base inward at least 1 to 2 inches. Then, place it on top of the forehead of the victim. Then, cross it over on the nape. Sir, can you just move? Turn around. So when we say cross it over, we are not going to perform a lock. We will just cross over on the nape. So from here, what we're going to do, we'll be crossing over again on top of the forehead. And remember, thumbs up position. Then, right tail always on top of the left tail. Then create an overhand loop. Then cross over again. The right tail on top of the left tail. Overhand loop once more. Then hide the excess part of the triangular bandage. The reason for this is so that it will not be a cause of delay in case that we will be needing to transfer the victim, and there will be certain obstructions along the way. No parts of the triangular bandage may be clipped on those obstructions that can cause the triangular bandage from getting from the victim. So from here, what we want to do is to keep the technique neat and clean. So what we're going to do here is to hide some of the excess, and then if you feel that there's a need to add additional tension here, let's say for example, there are slacking here, one of the ways to prevent severe bleeding will be to apply direct pressure. So what we can do, one of the uses of the apex is so that it can be used to add additional tension. So what we can do here, we can pull the apex down to add some additional compression on top of the injury of the victim, and then fold the base, then hide the apex like this way. So this is what we call the head topside technique. Probable injury will be an abrasion on top of the head of the victim. The next technique that I'll be showing you is what we call the burn face injury or the back of the head injury.